Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have David Meyer. He is a sports performance physical therapist, and he wrote the book, Injured to Elite, a guide to empowering yourself to transform your life after injury. There is an excerpt from that book on Kevin MD titled, Don't Be the Patient, that says this. David, welcome to the show.
Dr. Kevin, thank you for having me on.
So we'll get into your book and excerpt in a little bit, but first off, can you just share your story and journey to where you are today?
Yeah, I grew up 5'5" athlete. Father suffered from glomerulonephritis, 2 kidney transplants. First one from my grandmother, Pearl Meyer. Second one when I was in college in SUNY Albany, and eventually led to a lot of immunosuppressive therapies from a rejection. Ended up developing lung cancer, and he passed away. That year in 2006, the Mets were playing the St. Louis Cardinals in the NLCS. We grew up diehard baseball fans. My father and I had that connection through sports. And the Mets lost to the Cardinals in 2006, and my father passed away. A few weeks later, I was in Columbia Press, and I was just about to graduate from SUNY Albany, pre-med. My uncle's an orthopedic surgeon, said, don't do it. Whatever you do, don't do it. And I was struggling with organic chemistry anyway. And I wanted to go into a sports capacity. So my father passes away. I vow to my family, I'm going to do whatever I can to make this dream a reality. And oddly enough, 9 years later, the St. Louis Cardinals hire me, 5'5" David Meyer, that had no business being there. By the way, learning disabled, growing up, should have never gotten a doctorate. Went to NYU, got my DPT, lived out the dream, and realized, well, that's not my dream exactly anymore, because the burnout that occurred in my first few years of practice was a matter of me wanting to climb the ladder really quick, not really working on my own personal development enough early in my career. And it's been a journey since about 2017 when I left the St. Louis Cardinals of rediscovering my passion, as Angela Duckworth calls it, grit, passion, and perseverance, and really reconnecting with that and realizing that it all does really connect back to mindfulness and our own mindfulness. And now I'm working on a process to integrating this to my colleagues, because physical therapists are all trying to fix pain, musculoskeletal dysfunction. It's a misnomer. You can't really fix the nervous system. It's tuned that way. And I think we have it wrong. And that's why I published that article in my book as well, being that our patients don't know how to speak to their doctors. And of course, we can't expect every doctor to come into that session cool, calm, and collected. So we need to equip our patients with these abilities as well. And that was the metamorphosis of that.
As a primary care internal medicine physician, I think physical therapist, of course, is such a vital part of the team. I consult physical therapy all the time. Now that you have a platform, I have an audience of primary care clinicians. What do you think is the biggest misconception about physical therapy that you want to clear up?
I don't know. I might be more on your colleague's side. I don't really identify too much with the title physical therapist, but I could tell you this. We're not trying to fix anything, okay? We're trying to, but we got to change that paradigm. If the person comes in with lower back pain, right? Yes, sure. We understand biopsychosocial. We understand the connection to depression. We understand that. But let's all take a pause. It starts in your office, doc. And I know you guys and ladies do it so well already. You have a conversation, you try and tune down maybe some of that noise, but then they go to the physical therapist and all of a sudden they're put into the system. All right, whether it's putting a hot pack on it or it's creative exercise, whatever it is, they start to perpetuate this habit loop of chronic pain. And as we know, chronic pain and acute pain follow different pathways. The glial network in our brain, there's so many different and advances in neuroscience that have shown to us that chronic pain is not something that we just fix or treat with exercise and NSAIDs, all of these things. So we have to shift this paradigm to a mindful approach. Dr. Brewer, who I'm really fortunate enough to interview next Friday, is really kind of ahead of his time with that and teaching clinicians how to address their own burnout, their own anxiety, their own issues they're dealing with, so then they can go into that room, that session with their client, their patient, and they can really help them do the same. So I think that's where it starts, to be honest with you. I know it's not profound, but it's, for me, where it needs to be.
So let's talk about that excerpt from your book, Your book is titled Injured to Elite, A Guide to Empowering Yourself to Transform Your Life After Injury. And you wrote an article on Kevin MD, an excerpt, Don't Be the Patient, that says this. Now, for those who didn't get a chance to read that excerpt, can you just walk my audience through it and share the story of why you decided to share it?
Yeah, so my editor, Oleg Kagan, he said, this is a really important chapter, Conversations with Professionals, in my book. And we kind of had this conversation like, if there was anything that should be stapled to the door, glued to the door of every medical practice, it's this chapter. Because the funny thing is, the patients would come to me and they'd say, I'd ask them, how did it go with doc? Mm-hmm. Well, I don't really, they said just continue PT. Any insights, any learning? Did you ask any questions? No, I didn't ask that question. And I realized that their emotional brain, their deeper brain was really active in these sessions, and they weren't using mindfulness, and they certainly weren't coming in with intention of, hold on, let me ask you these questions. They're intimidated by all of you. Mm-hmm. Let's be honest. They're intimidated by you. And I think that's socioeconomically, that's status related. And these are all things we understand. When they come in, they should have a framework just like you have a framework, because ultimately it's not your health. It's their health. Mm-hmm. So the article is essentially walking somebody through when something sounds Latin, write it down, mm-hmm. right? Something as simple as that. Nobody's telling them these things. It's really pointing out the obvious. Also, framing questions better. When you're speaking to your physician or any healthcare practitioner, you should be trying to understand it in their experience, because what happens is the patient comes to you and they generalize it. They do N equals 1,000 and you're N equals 1. I don't care what your research is, you're still N equals 1 because you're one practitioner. But you have to remember, when they come in, we should also be communicating that back to them. In my experience, in my case, with my caseload, because then they leave and then they really take these generalizations to the PT, and then we're like, wait. No, they didn't say that, right? And things get lost in translation. Mm-hmm. It's really pointing out the obvious and us doing the fundamentals better. I think mindfulness is that. I think conversations is that. Communication is that. And I tried to do the sexy thing over the last few years of chasing, creating digital courses and all these, the secrets, the hacks. It's all nonsense. You don't have to hack anything. The hack in and of itself is doing the fundamentals really well. Talk to Elon Musk. I'm sure he would tell you the same thing. I did the basics really well. And he's shooting rockets into outer space. In healthcare, we have to remember that too. And it starts with communication.
So if a patient is in the exam room, and as you know, a lot of primary care doctors, they have like 10 to 15 minutes with each patient. And I'm sure a lot of patients, they feel the pressure of that time that the seconds are ticking away. So what's your advice to patients who find themselves in that situation where the doctor clearly doesn't have enough time? The doctor has a waiting room full of patients, only has like 5-10 minutes. They could be running behind. What's your advice to patients in that situation in terms of how they can better frame their questions and make sure that they can, empower themselves in that short time frame?
In K through 12, we need to start training people on assertiveness. Assertiveness, I think, is one of the most important skills we have in life. I'm not going to say not to worry about your doctor's caseload, because you might worry about it, but you need to assert yourself. Be the annoying person if you have to be. Assert yourself, and the way you assert yourself is not aggressively say, hey, doc, why are you rushing me out? And it's not passive aggressively of calling the front office and saying, making a complaint. It's asserting yourself and saying, doc, I'm not quite getting that. Let's go through that one more time. That's it. And then be quiet. In negotiation, the same thing. When you assert yourself, you make the statement, you express your needs, you're not being aggressive. We have to do that with our doctor. Doc, I'm not getting that. And then the doctor can choose to do what they want. If you need to rush out and you have your caseload, we're not changing healthcare in a day. I get that. But if something there is important and the doctor doesn't realize that, the only way we're going to have that awareness is if we put that elephant in the room. The same thing with the doctor. Assertiveness is not that difficult for a lot of practitioners because of the difference in status and things, but I think there has to be a change in balance of power there. So I guess, this really, look, all doctors are patients at some point or another. So I think it's just more of an education thing for me of getting this out prophylactically when they go into the office. Who knows? Maybe there should be some sign on the wall. Don't forget to ask your doctor the question you had. Fundamentals.
Now let's flip it. I think that from a physician standpoint, what kind of advice do you have for clinicians to make sure that we really do get all the patient's concerns addressed during that time?
Well, I don't know if you can get all their patient concerns addressed, but I think mindfulness is where it starts for you as well. So connect with that inner shadow. The inner shadow right there, the persona that Carl Jung talks about in the early 20th century. As a physician, you are feeling a stress response right there. As a matter of fact, you're going into your emotional brain. I'm stressed. I need to see my next patient. I need to, keep my quota. I need to make sure I get through the day. Take a second, take a breath, let the tight feeling kind of go through your body, and then let the curiosity, the awareness, okay, I want to at least make sure that the patient leaves knowing this. And that's it. It doesn't have to be solving their first of all, stop trying to solve all their problems if that's what you're trying to do. As primary care doctors, I get it. You have a lot of responsibilities. But as you all know, it's probably one or two things that you could really have that maximal impact with. If you use a little mindfulness for yourself, a little mindful moment, timeout moment that Dr. Brewer trained the clinicians over there, and I think it was in Massachusetts, the same thing for all of you. And check out his Unwinding Anxiety app if you haven't, because it's very, very pertinent for healthcare practitioners.
We're talking to David Meyer. He's a sports performance physical therapist, and he's the author of the book, Injured to Elite, a guide to empowering yourself to transform your life after injury. David, tell us a little bit about your book.
So the book essentially was a challenge. My patient, who was suffering from a little meniscectomy, and he was a MMA fighter or mixed martial artist, he says, Dave, I don't know if you can write a book. I think you have a lot to say, though. And being I had a little short man complex, like I was talking to you about before, I took that challenge very seriously, started writing, and it led into the 70,000 plus words or whatever it was. But it's basically the manuscript that anybody can read when going through any type of physical challenge primarily, because I looked out there was Dr. Sarno and Explain Pain, great work, inspired me, but there wasn't this guidebook of like covering sleep, nutrition, covering the mental side. That's a big focus for me, of course, the first section of my book, and you can listen for free to that section, injuredtoelite.com/listen. But it was essentially the how to go about the process, not the how to fix it, but an all-encompassing guide. And I wanted people to have this.
And what would you say is the number one actionable tip that your readers should take away from it?
I think that we compartmentalize things. We give agency to body parts. We give agency to my knee. I want to cut my leg off. It comes from an integration, right? So to integrate when we're going through a physical challenge, we can't have separation between any element, whether it's mind, body, all of that stuff. So this book really puts it in the context of your life, taking mental skills and applying them not only to going through the rehab process, but then what carries over to your relationships, what carries over to your career. It's really, I call it time zero. It's a reset point, and it's an opportunity if you really allow it to be. And that's really the big take home from it.
And my final question, what is the take-home message that you want to leave with the Kevin MD audience?
I think it's going to come down to purpose and mindfulness. So we're all stuck in habit loops of fixing our patients and fixing our pain and fixing our problems and social media followers. We all have to take a second. And our purpose is within us. I think we all have a good idea of it. But in order to break the loop of whatever cycle we're stuck in, we really truly have to be practicing what we preach. And it starts with us. It starts with the practitioner. And then we can help others out there, and not by fixing things.
And how can people reach you?
People can reach me on Instagram at Dave M. Meyer, or email me at davemeyer@plperform.com.
David, thank you so much for sharing your time and insight. And thanks again for being on the show.
My pleasure. Thank you for having me.